Cast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. My name is Jo Donlin, and I am the Director of Regulatory Outreach and Education at the Division of Professions and Occupations within DORA. I want to thank everyone so much for taking a few minutes today to learn more about the PDMP. I know that the pharmacy profession is very busy. All the prescribers are very busy during this pandemic, so giving a few minutes for educational purposes is much appreciated. This is the third webinar we are hosting as part of a 4-webinar series. And today my colleague, Justin Whip, will address the topic of unsolicited reports. And he will cover both patient alerts as well as prescriber reports. But before we get started, I do want to thank our sister agency, the Colorado Department of Public Health and Environment. This event is a joint effort between the two agencies, and we always appreciate their support and collaboration on this initiative. With that, I will turn it over to Justin, but if you have any, we'll have Q&A later in the half hour, but if you have any trouble hearing or anything like that, just use the question box and I will try to address those issues. So take it away, Justin.
Thank you, Jo. This is Justin Whip. I am the program analyst for the Prescription Drug Monitoring Program. Please bear with my voice. I am suffering from the wildfire smoke here, and our program director for the Board of Pharmacy, Dimitri Kunin, is also here in case I have any issues that require assistance in handling this webinar. So today's webinar will cover the 2 types of unsolicited reports sent by the Prescription Drug Monitoring Program. The first are patient alerts, and the second are prescriber reports, which are 1-page scorecards we send out on a quarterly basis to all prescribers with an active PDMP aware account and who have a specialty listed on their PDMP aware account. So the document that I'm going to cover today is found on our PDMP training website, which is dpo.colorado.gov/PDMP/training. We did put together 6 tutorials on this web page. Today we'll be covering this 5th document, the patient alerts and prescriber reports. And this page also does have recordings of our previous webinars, as well as links to register for our future webinar on bulk patient searches. We also have user guides and a delegate training video available on this training page. So today I'm going to essentially just go through this tutorial document on patient alerts and prescriber reports and explain what they are designed to do, and alleviate any questions or concerns folks might have. With respect to patient alerts, these are something that was first authorized by statute in 2014, and the State Board of Pharmacy consulted with Colorado's prescribing boards to develop criteria to alert prescribers and pharmacies or pharmacists when a patient meets the board's confidential multiple provider and multiple pharmacy threshold for suspected doctor shopping. The actual underlying threshold is confidential, and that was decided at the time that these were developed to prevent anyone who might be doctor shopping from knowing how to avoid triggering these alerts. Now, the notices here are issued to help providers deliver optimal care for their patients and should be interpreted within that clinical context. We're sending these alerts out to help providers assess the possibility of drug misuse or diversion, and we hope that they can help coordinate care among a patient's prescribers and pharmacies. When a patient meets the board's multiple provider and multiple pharmacy threshold, each prescriber that prescribed to that patient and each pharmacy that dispensed to that patient for the time period which triggered alert will receive a notice from the PDMP. If you have a PDMP aware account, you will receive an email from our system advising that a patient alert is has been loaded to your dashboard. So if you receive that alert, you can log into your PDMP account, and the dashboard on that main page will list the patient's name and date of birth who triggered the alert. And you'll be able to run a new patient search to find the most up-to-date prescription history for that patient. The text of that alert is just going to tell you that a patient that you prescribed or dispensed to appears to have potentially obtained prescriptions for controlled substances from multiple sources and in potentially harmful quantities. Again, this is the message that you'll be receiving via email if you trigger a patient, or if a patient of yours triggers an alert. The key thing to note here is that no conclusions or judgments are made by the Prescription Drug Monitoring Program on the basis of this information. We send these letters to prescribers and pharmacies in support of our mission to identify and inhibit the misuse and abuse of prescription drugs in a manner that would not impede the appropriate utilization of these medications for legitimate purposes. It should be noted that we do not have the full clinical context within the Prescription Drug Monitoring Program, so it is definitely possible that a patient who triggers an alert may have done so for an innocuous situation. Sometimes patients will have a surgery or go to the dentist and have a dental procedure and receive controlled medications in association with those procedures, which could, in addition to the medications that they're normally on, trigger one of these alerts. So it is important for you as a prescriber to review that patient's history and determine if this is evidence of the patient attempting to get the same medication from multiple providers, or if this is just something that was triggered based on legitimate medical need. We do have some frequently asked questions that we'd like to touch on here, which, just to reiterate, these alerts are sent to all prescribers and pharmacies that prescribed or dispensed a controlled substance to that patient during the time period which triggered the alert. And they are loaded to a prescriber's or a pharmacy manager's PDMP account on their dashboard. It's also found in the patient alerts menu of your PDMP account, which is found under the RX search heading. One question we sometimes get is, am I in trouble because I received one of these patient alerts? And the answer to that is no. One, these reports are generated for the purposes of information and education to an intervention to prevent and reduce occurrences of substance misuse, abuse, and diversion. And most importantly, these alerts are not public records. They are not discoverable or admissible in any criminal or administrative proceeding against a prescriber. And these are not something that the Prescription Drug Monitoring Program shares with your licensing board or any other entity. Another common question is what you should do if you receive a patient alert. If you have any concerns about the prescriptions that appear on a patient's PDMP report, you can contact other treating providers, assuming there are no HIPAA issues in terms of sharing information with other providers, in order to coordinate care and discuss concerns related to potential dangerous combinations or concurrent prescriptions for the same or similar medication, or potential issues of drug abuse, misuse, or diversion. And most importantly, the PDMP does not have information concerning the clinical context or underlying diagnoses, and we do not have information concerning which providers may be coordinating care with others. Therefore, no conclusions or judgments are made on the basis of the prescription information within the PDMP, and it is up to the treating providers to interpret and determine if the patient's prescriptions represent a danger to the patient's safety or reflect potential drug misuse, abuse, or diversion. One other thing to note is if a prescriber does not have a PMP aware account, they may receive a letter from the PDMP with the patient's information. If you do receive one of those letters notifying you that a patient triggered a patient alert, that should also prompt you to create a PMP aware account at colorado.pmpaware.net. It is statutorily required that all practitioners with a personal DEA license register and maintain a user account with the Colorado PDMP. So that covers essentially the patient alerts, and we'll now move on to the prescriber reports. Prescriber reports were started in 2018 as a result of grant funding that we received from Colorado Department of Public Health and Environment. These reports are also sometimes known as scorecards. We send them out quarterly, and they provide an overview of a prescriber's prescription history compared to that prescriber's peers within the same specialty. So we have sent these out since February 2018. The first iteration of the reports were sent to any prescriber who had at least one opioid prescription over the 6-month reporting period and who had a healthcare specialty listed on their profile. Beginning in January of 2020, we did launch an updated version of prescriber reports, and the updated version is now sent to all prescribers with an active PMP aware account and a specialty on file who wrote at least one opioid, sedative, or stimulant prescription over the 6-month reporting period. The new version also displays monthly prescription data, which helps illustrate prescribing trends over time. Some of the key metrics on these reports include both prescriber-specific and peer group averages for monthly opioid, buprenorphine, sedative, and stimulant prescribing, including average prescriptions per patient, average quantity, and average duration or days supply. There's also PDMP utilization information, which will let the prescriber know how many patient searches they performed or how many searches were performed by their delegates. Other information includes number of patients receiving potentially dangerous combinations of opioids and benzodiazepines, or opioids, benzodiazepines, and carisoprodol. There's also an alert on the number of patients receiving controlled substance prescriptions from 5 or more prescribers or 5 or more pharmacies over the 6-month reporting period. And there are also reports with the number of patients receiving opioids with a daily morphine milligram equivalent dosage over 90 and 120 respectively, which is alignment with CDC's guidelines for opioid prescribing. In terms of frequently asked questions, we often have folks wanting to know what they should do with this information. The prescriber reports give you a high-level overview of your prescribing compared to others in your specialty. Now, the specialty that we use for these comparisons is something that you select when you create your PDMP account. It should also be noted that you can change your specialty at any time in the My Profile section of your account. That would be found if you log into your PMP Aware account through the link under your name at the top right corner of the page. And it should be noted that these reports are provided to support the PDMP's mission to prevent the potential misuse and abuse of prescription drugs, and should not be used to impede the appropriate prescribing of any medications for legitimate purposes. And once again, we sometimes get questions of whether or not someone's in trouble by being shown as an outlier or perhaps prescribing higher than their peers, and that is absolutely not the case. These prescriber reports, just like patient alerts, are confidential, not shared with any prescribing boards or any healthcare organization that you might work for, and they are not discoverable or admissible in any type of criminal or administrative proceeding against an individual. So again, when you first created your account, you would have selected the healthcare specialty. And when you're looking at your prescriber report towards the top, you will see, here's a sample of the prescriber report, the number of total prescribers within your specialty. You'll see the specialty listed at the top of that report. It can be the case that you may be in a relatively small specialty group, and it is ultimately a combination of what you've chosen and what your peers have chosen in determining not only what specialty you're in, but the size of that specialty that you're compared against. Some folks may be in a very general category currently, like family or internal medicine, and may actually be prescribing in a manner that's more consistent with something like pain medicine or hospice and palliative care, etc. Again, this report is not based on necessarily what your board's certified in, but in what you've selected on your account. So you can always review the list of available specialties and make changes if you don't believe this is capturing the most correct or appropriate specialty for you. It should be noted, if you do change your specialty, it is not going to generate a new scorecard for the previous period, but in the following quarter, you'll receive a prescriber report with that updated specialty comparison. Again, as you look through this report, the blue bars are going to be your prescription information, and the pink line is going to be the peer specialty. So here you will have information including the number of prescriptions per patient in the opioid category, average daily morphine milligram equivalents, average quantities of prescriptions per patient, and then the average duration. You'll also see the number of patients for you here and the number of patients on average for your peers. And again, very similar information for the other drug categories. Buprenorphine is separated from other opioids, and that information is displayed in its own category. And then again, sedatives, including benzodiazepines and other sedatives, are in that category. And then stimulants make up the last category. Down at the bottom is the potentially at-risk patients information. Again, the dangerous combination information of benzodiazepines and opioids. Multiple providers, you'll find a number of patients of yours with 5 or more prescribers, number of patients of yours with 5 or more pharmacies, and also the number of patients receiving over 90 morphine milligram equivalents or over 120 morphine milligram equivalents. And then finally, there's a PDMP usage section, which will show how many searches you performed over the 6-month reporting period, how many searches were performed by any possible delegates, and then a total for you and your delegates combined. So that essentially summarizes the prescriber reports and patient alerts. And at this point, we can take some questions.
Okay, thank you, Justin. And I just want to remind our participants, if you want to ask a question, please type it into the question box, and then I will read those, and then Justin will answer them. So just as a reminder, that's how we're doing the Q&A. Since we have quite a few people, it gets complicated doing live questions. But we do have a question, again, about the specialty. The question is, can you explain again, I'm not sure I have a specialty, or if I want to change it, what do I do?
Yes, so you can log in to your PMPware account at colorado.pmpaware.net. Now, if you received a prescriber report recently, we would have sent that report to the email address associated with your account. If you've never received a prescriber report, it may be that you don't have an active PMPware account, or you may not have logged in to the PMPware platform since we launched that in August of 2017 and may not have added a specialty. When you log into your PMPware account, you'll have a link under your name at the top right corner of the web portal. You click on your name, you will see a My Profile link. When you go into the My Profile section, there's a option to make changes to or review your specialty. And Joe, if you can unshare my screen for a moment, I can try to pull up an account to give someone a visual of that. I just don't want to toggle through too many screens.
Okay, let me change that for just a second.
Okay. Okay. Okay.
Are you
Let's
ready to go
share
back?
my screen again. Yes. Okay, so here is what the dashboard looks like when you first log in. And also I'll point out the patient alerts, if you have any, will show up right here. They're also available in this menu link. Patient alerts are found here. And then the My Profile can be found right here or through here. When you go to My Profile, you will right here have your specialty that's been selected, and you can also make changes to it. There are a lot of options in here ranging from very general, like emergency medicine, family medicine, internal medicine, to much more specific categories. Now, they use the CMS provider taxonomy crosswalk for this list, so it is quite long, but it's really up to you in choosing something specific or general, depending on really the population that you're treating and the type of controlled substance prescribing that you're performing. So lots of options in here. You can select more than one specialty, but only the primary specialty as designated with this star will be used for your prescriber report. It should also be noted in the My Profile section, if you ever want to change your email address, you can do so in the contact information there. And again, the dashboard will display any potential patient alerts right here. And through this menu, if you do receive a patient alert, you'll want to run a patient request to get the most up-to-date prescription history for that patient. When doing the patient request, you need to use first name, last name, date of birth. The search defaults to the past year. The prescription information triggering a patient alert only concerns Colorado PDMP data, but there are lists of other states that you can also search when performing a patient search.
Okay, great. Thanks, Justin. We have a question regarding, is there an annual report possible, or would I just need to accumulate the quarterly reports and tally them up myself?
Yeah, the reports are sent out quarterly, but they do cover the previous 6 months worth of data. So if you were looking to accumulate, say, all of 2020, the report that was sent in July that covered the first half of the year, and then the report that would be coming out in January 2021 covering the second half of the year would, between those two reports, cover the full year.
Okay. I think you just said that when you were talking, but how would someone change their primary contact phone number?
So that is actually not available to change in here in the profile info, though the option to add a mobile phone is available and can be changed at any time. And we will soon have a feature where if you need to reset your password, you can have that sent via text message if you have a mobile phone number on file. Generally speaking, any of our communications are going to be via email. So we don't actually use your primary contact phone number, generally speaking. Any attempt to communicate with you will first be done via email.
Okay. The next question, and if there are any others, we still have 3 minutes. So, is there a way to easily do a search on previously searched patients without having to start a new search?
Well, the requests history will show you who you've previously searched. And there is an option for a bulk patient search, which we will discuss in our next webinar next week. And with the bulk patient search, you can essentially save a spreadsheet with a list of patient first name, last name, and date of birth. And you can run another report with that saved list. And that will allow you essentially to search those patients once again with that previously saved file.
Okay.
And that's also something, if you have delegates, that the delegates can perform on your behalf.
Okay. That is, there might be one more. We have an Alan Brewer. Alan, if you want to write in your question, it'll pop into my screen and then I can read it to Justin. We'll just give it a second. We're almost to our time limit. Oh, okay. Alan said he hit his button by mistake, so that's okay. Thank you. I think that we are right at 12:59. I don't have any other questions in the queue, Justin. So thank you for that great presentation. I do, as Justin just said, I do want to remind everybody that the fourth in this series of webinars will be held next Friday, August 21st, same time, 12:30. And it will discuss the topic of how to do a bulk patient search. It's something that we get a lot of questions on, especially if a delegate is looking to look at a bunch of patients for a provider's full day of appointments, or a provider is trying to look at a history of things. So we hope you will join us. And all of these are recorded, so they will all be posted on the PDMP website. And there's a special page right at the top. You'll see a button that says tutorials and webinars. So that's where you can find this recording should you need to review the information again. So I want to thank everyone again, and I hope everyone is doing well. And hopefully we will see you next week. Thanks so much.